use laser. And even you are using the cannula, please use the bevel down. And then go up to here. We're going to shoot very little amount. Under the eye area, more or less amount, okay? Laser, laser, laser. Okay, very small amount under the eye. So here, laser, laser.
ตอนไปทำกันเองทำช้ากว่านี้ก็ได้นะครับไม่ต้องรีบ อันนี้ขอเดี๋ยวรีบ
Okay, so I use 2 cc here, okay? 2 cc.
Okay.
Okay, give me the RF cannula.
So why you mix it with the normal saline? Why not you use the pure lidocaine? What is your reason?
Because it's too much.
Okay.
In small area, too much. So
I think because he want to do like 2% solution,
21
and
G.
also usually when we
Small.
do a lot of lidocaine injection, you have to be concerned about the toxicity as well. 2% lidocaine, on average, people with around 50 to 60 kilogram,
Yeah.
we can use without toxicity. The maximum is about 20 mil.
แล้วก็อย่างหนึงมันจะเจ็บน้อยกว่านิดนึงครับพี่เพราะถ้าเพียวมันจะแสบเยอะมากนะครับเวลาเจอคนไข้จริงนะครับ
เวลาเราผสมแบบเนี้ยมันก็จะทำให้กระจายได้กว้างเร็วขึ้นแล้วก็ใช้ยาน้อยลงไม่ต้องกังวล toxicity แต่ประเด็นคือมันก็อาจจะอยู่ไม่นานครับก็แป๊บเดียวตรงนี้ทำให้เสร็จ
Okay, so we are ready. It's a very quick, short procedure. When you are melting the filler, also same, okay? You put the lidocaine, epinephrine, and you do this one. So it's not that difficult. Can you come here?
So what's the size of the cannula that
This one I'm using right now 21G 5 cm cannula. So if you have an assistant, let it stretch a little bit. It will help you more. So now I'm starting. Okay, so we are going in. I can feel the fat become smoother after just 1, 2, 3 stroke. Okay, become smoother. Okay.
So can you tell me about the energy that you use? 6 or 7? The energy.
Energy, I'm using 7.
7.
Usually I use 7. Under the eye, 6. Okay.
Okay.
So actually, if you get used to it, you can feel with your fingers. So you don't even have to look at it. Okay. You can feel with your fingers. Okay.
So the end point is loosening side, right?
Yes, loosening. But I advise not to use more than 3 to 4 minutes one area, especially with the one hole. If you want to do it more, still up to 5 minutes, no problem. But use the different hole, okay? Because I made a 2 puncture, right?
Okay.
Now I used it 52 seconds. And also the area you want to improve the marionette line, you have to concentrate this area here, this area, right before the marionette, okay? So you're going to break it here, okay? You're going to break down here the fats and the hard connective tissues here. So sometimes you will meet some resistance, especially here, what we call the buccal fat area. But you know the buccal fat is not the real buccal fat, but this is a kind of a bunch of connective tissues here. So you're going to break here first. And here very easy, here very smooth. Now I use 1 minute and 22 seconds, actually almost ready. But I will do it from the other point.
Are you focusing on the subdermal layer?
Subdermal, but let's say here, upper subq as well.
Superficial subq.
Yeah, yes.
So for this area, did you ever face with the complication of the marginal mandibular branch nerve injury?
0%, because this is a blunt cannula, and you are not I'm not stopping in one area. You see, I'm keep on moving it.
I mean that
Yeah.
as you will be injured from the heat. Did you ever?
No,
face with
no.
that?
Never. I already done thousands of cases, but I never had any single problem. You know, before when I do the the ultrasound. Do you know ultrasound liposuction machine?
Yeah, yeah.
The Ultra Z and all those machines. What's the name
The
again?
one type.
The from the US, the ultrasound. Anyway, the ultrasound liposuction machine I also used a lot. That one I had a many case of the palsy like
Yeah.
for 1 month. But this one I never had single accident like that. So now I did a 2 minute 13 second finish. I'm done here. And now I'm going to do. Can you see a little changes already in the
Can you let the
shape?
patient
Okay.
sit up?
Can you go in the middle?
ที่ผมถามเนี่ยเพราะว่าต้องระมัดระวังถ้าฮีทมัน accumulate เยอะๆนะครับมันอาจจะเกิด injury ได้แต่ถ้าเกิดมันก็จะเป็นแค่ไมล์เคไม่ได้ถึงแบบเนิร์ฟขาดหรือว่าอะไรขนาดนั้นแต่ว่าเดี๋ยวพอไปทำกันอาจจะเจอจริงว่าแบบมีแบบเหมือนปากเบี้ยวนิดนึงแต่ก็จะเป็นแค่ไม่กี่วันนะครับอาจจะเกิดได้เพราะฉะนั้นคือพยายาม follow ตาม protocol energy แล้วก็เวลาที่เขาใช้นะครับ
นะเอาลงเอาของให้ผมหน่อย
the maximum
ถอยมา
result
ถอยมาให้ผมหน่อย
so Dr.
ไฟ
Kwon
มันแรง
we
ไหม
have the question about the maximum result
โอเคพอแล้ว
of
ครับ
the RF lipolysis here
Maximum
maximum result
result.
yeah
Because it's like this, I usually explain to my patient, thermage is also RF, but they do from outside.
outside
And the temperature, maximum temperature is 42, 40, 42, maximum maybe 45, but it's pain and the heat. So this one I tell my patient, I make a puncture, I go inside, I do the 50-degree up and down,
50.
which is more effective. I tell you, this is much more effective than thermage because I sold my thermage already many years ago. So I don't use it anymore. So this one, the patient understand, and especially I tell them, I do combine with the thread, I do combine with the ultra cold, the result is much better. Usually they all do together.
so the maximum is 1 month or 2 months
Same about the collagen reconstruction inside.
2
So about
months.
1 to 2 months, 2 months, yes.
and can we repeat it 2 months at 2 months
Yeah, maximum 2 to 3 months after. Can you see the difference here? You see this is bulging, sagging, but this area is a little bit better. Yeah, you can see this area actually already.
มีรูป before เขาไหมครับ
Yeah. Already sunken a little bit. Can you see?
yeah
Yeah. Anyway, we do the eye area.
here is the
Okay.
before picture
Yes.
it's better
Yes. Okay, let's do eye area.
โอเคเดี๋ยวนอนต่อได้เลยครับผม
Can you?
Dr. Kwon, we have like 20 minutes left.
How many minutes left?
20
Oh, we still have a lot of time.
if you can finish at 15 it's gonna be better because we have the rest time for that question
Okay, sure. I will do only one side, okay?
okay
Okay, so make sure you cannularize in, and if your assistant can stretch it more better. And also, please aim superficial like this, okay? You don't have to go in too much. You aim superficial. This will be extremely effective for the slight eye bag patient. So you're going to do some dissection this way. It's easy, okay? It's not that difficult. Just go slowly, okay? Slowly. Then it's very easy. And especially here, you remember the teardrop line. So we're going to do some dissection here more. So we make it even. Here a little bit more. And then we go here. Under the eye area, you don't have to do too much, okay? Actually, under the eye, you can reduce some power to 6. I reduce now to 6.
อันนี้ต้องดูเพลนดีๆ ใช่ครับถ้าผิดเพลนถ้าลงลึกไปมันก็ไม่ได้ผลเลยครับกำลังจะถาม
so Dr. Kwon this
Yeah.
is the same plane right
Yes, not very deep, okay? And then especially you have to take care of this eye bag line here, the teardrop line, because we want to make it even layer, so they will look like improved. So here we're going to concentrate more here, this area, especially here. Yeah, it's just a little bit more. You know, this is very smooth. And blunt cannula, 21G, so don't worry, okay? Even accidentally, you poke out here like this, poke out. No problem, there will be no scar, there will be nothing happen, okay? I also did many times. Patient.
And for in case of ice bag, Dr. Fon, can
Yeah.
you use this machine to do the tightening of the orbital septum? Because we ever saw about the paper that you can use IF or laser to tightening the orbital septum and to make the eye bag better. Can you do this
Yes.
with this machine?
I improve those eye bags who need the surgery, but I use this machine, I let them do surgery.
But the plane of the orbital septum is deep, so you can use this machine.
You can go a little bit deeper. Yeah, because I'm just telling you because for the safety, superficial layer.
Right.
But actually, if you are already professional, you can go a little bit deeper, no problem.
Because in my practice, I use this machine to treat the eye bags.
Yeah.
The subcutaneous plane to do the lipolysis, and after that, go deeper under the muscle to make the orbital septum tightening.
Remove this one.
แต่ต้องระวังนะครับ เพราะมันลงลึกมากเลยนะครับ แล้วก็ทำสั้นๆ แค่ประมาณสักไม่เกิน 45 วินะครับ
Can you remove this one? Can you? No, remove. Okay, we are done under the eye area, so please take a look at first before I put the ultra core.
โอเคครับ งั้นลุกนั่งนิดนึงครับผม so let the patient
ทำไมเช็ดไม่ออกอะ
mark
เป็นpermanent บอกว่าเนี่ย
The marker cannot remove it.
permanent
She has to go home like this. Sit up, please.
นั่งหน่อยครับ นั่งหน่อยครับ ขอดูหน่อยฮะ ขอรูปด้วยนะครับ ขอรูป before ด้วยนะครับ
The older looking, okay? So now we will put the ultra core 200 under the eye, and we will do some thread on the right lower area, okay? Come on, let's do it. Okay, so the ultra core, can you come up here? 200, okay? So it's ready to use.
so 200 in 4 cc
Yeah, 4 cc dilution, 200. Okay, yes, 4 cc dilution. And then, even though this is a 23G, 5 cm cannula, please make bevel down, okay, bevel down. Better down. Okay, come on. Okay, so let's go. Okay, so bevel down, go in, and make sure superficial, okay? You see the superficial, okay? Don't go deep, because our layer is to stimulate the collagen and make the tightening and firming. So you see, we go up to the end of the lower eyelid margin. Can you see it? So we go up to here, and then please don't shoot too much, but shoot small, up to the 1 cm from the entry point. Okay? Now we go to medial, about 1 cm medial. You see the cannula superficial? Don't worry, okay? And go up to the end. Can you see the end is poking here? The end. So here, again, shoot small. Make it even, okay? Don't shoot, stop, don't. So here, as we go, the very important area here. Can you see here, the very tear-through area here? So this is our main target to make it more even. Shoot here a little bit more. Shoot here a little bit more. This is the area I told you, which other fillers very difficult to do, because this is liquid. If you use the PLA or PLA, here, it will become very stiff, okay? And here we go up to here, shoot again, small here, up to here, small. here, small.
Actually, this is the same plane that you just did the RF cannula.
You are right. Yeah, that's why. Because we are reconstructing the collagen structure there, so they will have a very even looking surface. Okay? Actually, I can show you one more technique, which this area here, this area, can you see this area? Most of the lady patient, they have sunken problem here. So go straight lateral, meet the hairline, another ultra cold. So
เดี๋
we're
ยวเปลี่ยน
going
เปลี่ยนมุมกล้องนิดนึงครับไปทางด้านข้างนิดนึงครับ
puncture. Okay, this is the also area which cannot be done by other fillers usually.
so Dr. Kwan just wait for the camera Dr. Kwan
Okay, okay.
so again what is the size of the cannula that you use that is 23
23G, 5 cm.
ต้องมาฝั่งนี้นะ
Okay.
มืดมาก
Come.
and I saw your side ring one stroke you inject just only about the 0.1 cc one stroke
Yeah, one stroke, 0.1 or 0.15. That's the maximum. Then you are very safe, okay? Don't inject too much. So anyway, here, can you take a look at this area here? This is the sunken. Most of the ladies, this area is sunken. So we go in, level down, we go in here. Can you see we go even up to here? So usually 1 cm lateral to the lateral epicanthus and shoot small. Also this area shoot small. You know this is a liquid, so you can do it with it very safely, okay? And if you can shoot a little bit more here, and also this area a little bit sunken some patient, so you can have a lifting as well because this is collagen stimulation and they will give a lifting after few weeks. Okay, so you can inject here also very freely. I told you there are not much filler can inject this area with it safely.
ดูเพลนดีๆนะครับสับคิวนะครับ
Yeah, this is all subdermal or upper. Upper subq. Yes. So we are done. Okay, let's patient sit up and take a look at these lines. It's beautiful already. Okay.
แล้วก็เวลาฉีดแบบนี้ระวังเรื่องอะเซปติกเทคนิคนิดนึง แล้วถึงระวังในเบตาดีนขาดตลอดนะครับ
โอเคครับกล้องหน้าแล้วขอ before นะฮะ เน้นย้ำอีกทีนึงนะครับยังไงมันก็มีโอกาสที่จะ obstruction เหมือนกันนะครับ ต้องระมัดระวังเพลนต้องถูกเสมอนะครับแล้วก็แคนูล่าจะสังเกตว่าเขาใช้แคนูล่าค่อนข้างใหญ่คือ 23G นะครับคือจากเปเปอร์ก็บอกแล้วถ้า 25G หรือว่าเล็กลงไปกว่า 25 มัน as a needle นะครับเพราะฉะนั้นก็พยายาม select แคนูล่าที่ใหญ่ก็จะพอช่วยได้นะครับ
หมายย่อ
หน้าจอ
โอเคขึ้นจอนิดนึงครับ
It's not showing yet.
เอาขึ้นจอหนะครับโอเคขอไฟเข้าตรงฝั่งขวาของคนไข้นิดนึงครับเห็นไหมฮะ
ฝั่งนิดหนึ่งอีกพี่
นิดนึงครับอีกนิดนึง
เข้าไปตรงนั้นน่ะ
มันเป็นเงาโอเค
Yeah,
โอเค
yes.
โอเคครับ
Can you see the line here, especially on this area? The line is different, okay? So you are shooting on this area, you are creating very soft contouring, okay? Which is not able to do with many other fillers, okay? And it's a liquid, stimulate collagen, so after 1 month, 2 months, it's more better. Okay, so this is a wonderful area which only can be done by the ultracold, okay? I told you it's very difficult to do with the PLA or the PCL, this area, okay? Because in nature, PLA is very stiff. So it's very difficult. Only PDO can do this one, okay?
Okay. I think that because of the time, we just finished one side.
Okay,
Because
yes.
We have the event
I will
outside.
do the thread,
The
just
thread,
three
okay.
thread, okay?
The thread แต่ในชีวิตจริงอะนะครับ split
Design
session ก็ได้นะครับ เพราะว่าจริงๆคนไข้จะรวมค่อนข้างเยอะ ถ้าเราทำทุกๆอย่างในอันเดียวกัน แล้วก็ที่สำคัญอีกอย่างหนึงคือหลังจากการที่เราทำไม่ว่าจะเป็นฉีดลิโดเคนนะครับที่ astigmatiscence นะครับเราฉีด outer core เข้าไปด้วยเพลนที่เราจะร้อยไหมเนี่ยมันจะ loose นะครับเพราะฉะนั้นจริงๆแล้วเนี่ยในบางทีเนี่ยไหมมันจะเกาะได้ไม่ดีโดยส่วนตัวผมจะ split session นะครับ
Okay, so from the lips, you go down straight, and in the middle, one cm up, 1 cm down, okay? And here, tragus, 1 cm, 2 cm, 3 cm front will be your landmark. 1 cm down, 1 cm down. So usually, we put three cannulas, okay? And please prepare also the tornado, 10 tornado, okay?
ถ้าโดน2 อัน อันนี้เอ็นให้อีกอันเนี่ยทาราโดเนี่ย
So inject
ไหม
needle epi,
อันนี้ไม่ใช่ถุง
puncture 18G. Okay, 18G.
Dr. Kwan, please show the thread before you insert.
Okay. So we're going to puncture the area where we inject only the entry point, okay, usually. So this is a 18G. This is a cannula, okay, cannula.
ผู้ช่วยซับเลือด
With I think this is a mold cannula.
ผู้ช่วยคอยซับเลือดคนหนึ่ง
So usually mold or coke, the technique is the same, okay? When they use the cannula, technique is same. So you have to take note of the landmarks. Usually from the middle and 1 cm below, 1 cm up, okay? 3. If, like actually she's a little bit chubby here, if you want more defined jawline, you can put it here also 1, 2, 3. So you can make her something like this, okay? Something like this. But anyway, now I'm going to show you the technique. Please hold here. Okay. Okay. If your assistant full stretch, it will be better. Okay. Also here, okay. So when you go in, please go in, and then initially you pull this way to make the cannula advance better, but make sure your cannula bevel down. If you don't make the bevel down, you have more trouble with the dimpling and the irregularities. So make sure bevel down, okay? And then when you are in the midway, this time you pull the skin of the patient toward you like this, okay? This is the easy way to do, okay? Pull toward you, and then you go in slowly, up to the point where you design. Okay, here. Can you see the end? It's here, right? Can you see it? So you go there, and when you take out, please press gently, and then shake. Don't rotate it, but shake it. Take out slowly. Okay, so we are done with the one thread, one cannula, and the next one. We go bevel down, go in, initially pull away from you, and then when you are in the midway, pull toward you, okay? So this will make you a lot easier. I don't even see it can go in, okay? So it can be toward you, and then you can take out. Don't be hurry when you are doing the cannula, okay? The thread. Because I see many doctors go very hurry. Don't do that. Just relax. Do it slowly, slowly, slowly. You will reach the goal. Okay. So now the last one. Go in, pull away from you. Halfway, you are halfway, and then you will pull toward you the skin. Then you go in. So you are here already. Okay. So remove. You are here already. Okay. You see, you are here. Okay. So hold it gently and take out slowly. Okay, so we're done. And then don't pull too much, okay? Our technique before 10 years ago, 15 years ago, I pull, I anchor, I do this technique, this will all give you a headache. Believe me, don't do that. No need to do. Just pull gently, the three of them gently, and one by one, check. Because if you pull too much, like this one, you might have a dimpling here. You see the dimpling here? And also the dimpling here. So be careful when you cut. So look, pull, cut, lift up, cut, you see? I mean you pull, cut, these are moving, so you might create dimpling, but you lift up, don't move. So you lift up, okay? You lift up. It's very important, okay? You lift up this way, okay? So we'll cut. Cutting, you always go in 0.5 centimeter to 1 centimeter inside and you cut. Because if you don't do that, there are cases that protrude out here, poke out here, okay? So go in and cut. And you have some dimpling, you can remove it right away. Hold the half and get a new one and you will wipe this way, okay? 1, 2, you see the dimpling here, right? Dimpling, 1, 2, 3. 1, 2, 3. Okay. So this problem again with can you remove this one? How come this one don't go in? Give me the alcohol. Alcohol. Can you get rid of this marking?
ลูกอย่างแอลกอฮอล์เอาแก้ว
Please wipe. Okay. Okay, so we are done. And now, if you want it last longer, I always tell you, no matter how strong is the cork, how strong is the mold, they will not last more than 6 months if you use only this PDO cannula, okay? So we want to let it last longer. We have to combine the collagen stimulating technique, okay? So give me the tornado.
เดี๋ยวเธอนาดูไม่มีแค่5
So please finish in a few minutes.
Yes.
โนทานาโด
Tornado, give me tornado. Fine, okay, just give me 5. Okay, so actually, if you want to do it better, you have to put the tornado where you put the cannula. You have to put here 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, at least 9. Then you have a much better result, long lasting. Okay, but now due to the time limit, I will just do 5. Okay, so here, the needle you have to make sure the bevel up. I said cannula bevel down, right? But needle bevel up. So it's opposite, so please remember.
So this is 90 millimeter.
This is a 60, 80 or 60, 90 tornado. So here, this way, you got the point. So this area will be stimulated by the collagen. So this collagen will hold the skin. Even the cork or the mold cork will melt after 4, 5, 6 months later. They will not make the sudden drop down because of this strong holding of the collagen. Okay, so that's why you use the cannula and you use the ultra cold also can be an option. You use the cannula and you use the mono or tornado double twist. This also can be an option. Okay, so we combine the collagen stimulation and the mechanical lifting together. Okay, you have to understand this concept. Okay, so let's sit up and take a look.
โอเค
We clean up. Clean up.
คุณค่าเป็นไงเจ็บไหมครับ
Sit up, please.
เจ็บไหมคะ
Okay, wake up.
โอเค
Wake up, wake up.
เดี๋ยวลุกขึ้นนั่งนะครับ แล้วก็ขอรูป before ครับผม
มีรูปด้านข้างไหมกดรูปด้านข้าง
The light is not really good. Anyway, you can see here this area. This area. Sorry.
เดี๋ยวหันตะแคงซ้ายนิดนึงครับ
Yeah.
โอเคก่อนโอเค
Yeah, you can see the marionette line improves a lot better.
yeah
Actually, if we combine more tornadoes here on the lateral side, then the result will be much better. And also, she is a little bit chubby patient, so we have to do actually under the lower area here, lower area. Then she looks have a more defined jawline.
โอเค
Okay, anyway, this is the combination of the RF cannula and the real result will come after 1 month, 2 months after. Okay, usually up to 3 months if you do the collagen stimulation technique. So this is the simple way to combine for the eye bag and sunken eye and the bulldog, the area. Okay, any
Fine.
questions?
thank you so much มีคำถามไหมครับ โอเคครับ ขอสัก 2 คำถามนะครับ
In the significant eye bag patient,
Yes.
what exactly the position of the IF cannula probe that you put it inside? Is it exactly position of the eye bags, or is it more superficial than
Okay.
that?
Okay, it's like this. We have an eye bag. Slide. We call it, let's say, first step, simple one. We can do thread alone. Especially, have you ever seen the super tornado thread? So we put the thread alone. If someone who wants more, RF cannula and the thread. If someone who wants the more, RF cannula, thread, and the ultra coil. Why ultra coil for the eye bag? It's quite strange, right? I told you if you put the ultra coil a little bit more, there might be more bulging. How can you use the ultra coil for the eye bag unless the sunken eye, right? So where we're going to use is the border, which there is a sunken. You can use the ultra coil here. So we bring up there. So the eye bag usually bulging, and the lower area looks like a sunken. So we bring down the eye bag like this. We bring up the area like this. So we improve the eye bag. So in this case, we can combine it.
I mean, if we do only the IF cannula alone, the plane, you mentioned the superficial plane, right?
Yes.
But if the eye bag is significant, or is it very prominent eye bag, but the patient doesn't want the surgery, they just want the IF cannula. What exactly is the plane of the probe of the IF cannula?
Plane,
that you
actually,
put in?
plane is the same, but you have to understand, if someone who is really too much eye bag, it's a time for the surgery. But this one is usually between 35 to 45, 50. Those who have a slight eye bag, but they don't want to do surgery, so these are the indication is for these people.
So the probe of the IF cannula is not placed on the fat.
We are
but
not
placed-
going to melt the fat.
Okay.
Yeah, but as we mentioned with the Dr. Fruit, can go if you've been doing many cases, then you can go a little bit deeper and you can do some,
How deep?
still not too deep. So we are more on the skin tightening. We are not after the fat melting here, especially this area.
So you not go not more than the orbital septum, right?
No.
Just superficial to
Yes.
the muscles, right?
Somewhere just around there, up to there. Yes. We don't go deep.
deeper than the muscles. With the deepest plane that you can go, is it above the muscles?
Above the
muscle?
muscle. Above the
Or
muscle.
below the
Yes.
muscle?
Yes. Above the muscle.
muscles.
Yes.
Okay, thank you.
I think the point of the RF cannula is to tighten the skin.
Yes. The
Yes.
main point is to
But,
tighten the skin.
But when we see the patient with the large eye bag, I think we have to evaluate first. In some cases, like in young adults, because of the loss of support, the bone support. So probably we need something else to support.
That case, we need a thread. We put the thread. You know, just like you are building construction, you dig the land, you put the pipe, and you put the concrete. So this building, the pipe is equivalent to thread, and this concrete equivalent to ultra cold. That's why I showed you one case, actually more than 55 bulging eye bag. I improved with this 5 thread and the ultra cold. So it depends on the case by case. But most of the time, if 70 years old people come to me for the eye bag, I tell them to go to surgery. But so our indication is like a 35 to 55 within this range. The one who don't want the surgery is not really yet for the surgery, so we can delay them. So you have to find the good indication. I always tell you, good doctor, find the good indication. It's not treating good.
So for this point, I think that I emphasize you to do the paper again because in my experience, I try to melt the fat, intra-orbital fat, like I said before, and I try to tightening the orbital septum, go deeper, but must be careful in that place. But if you're professional enough, you can try that. But now it's not have the paper from the RF cannula to do that. Maybe in the future you will learn this.
That's why
paper.
actually most of you are first timer to RF cannula. That's why I don't emphasize that.
Yeah.
But I mentioned to you also, if you are professional already in many cases, you can do that little by little. But for the beginners, starters, you do only the skin tightening. The result is so much great. You don't really have to do melt the fat, okay?
I think that next year we collect the case together and present this.
Okay, any more questions?
มีไหมฮะ โอเค ถ้าไม่มีคำถาม พี่บอยจะกล่าวอะไรปิดไหมฮะ สรุปนิดนึงแล้วเดี๋ยวผมปิดท้ายก็ได้ครับผม
จริงๆแล้วทุกทรีทเมนต์มันก็มีคอมพลิเคชันได้นะครับ แล้วก็หลายๆ
ที่ของพวกเราเองเป็นสิ่งสำคัญอย่างวันนี้เราเรียนรู้ Product ใหม่ๆ ซึ่งทุก Product นะอันนี้คอนเฟิร์มให้เจี๊ยบได้ว่าเขาขอออยเรียบร้อยนะครับแต่ยังไงก็ตามออยที่อะไรเกี่ยวกับเมโสเรารู้กันอยู่แล้วว่ามันคือออยที่เป็น apply คือทานะครับเมื่อไปฉีดต้องระมัดระวังเป็นอย่างมากแต่ถามว่าออยรู้ไหมว่าใน practice จริงๆทำรู้แต่ขอให้มีออย approve 1 ขั้นตอนก่อนเราจะ protect ตัวเราเองได้แต่ถ้าเรา select product เข้ามาโดยที่ไม่เคยมีออย register เลยอันนี้ชิบหายแน่นอนนะครับเพราะฉะนั้นคือเมื่อเรื่องเข้าไปยังแพทยสภาซึ่งต่อไปหวังว่าเราจะมีกรรมการแพทยสภาชื่อคุณหมอพุทธิพงศ์นะฮะเพราะว่าพี่บอยน่าจะช่วยเราได้เยอะนะครับเพราะว่าคือในความเป็นจริงหลายอย่างมันไม่ได้ถูก approve อย่างตรงไปตรงมาแต่อย่างน้อยขอให้มี1 approve จากออยเขาจะฟังเราครับแต่ถ้าเราไป select product ที่ไม่เคยมีการ register มาก่อนเลยอันนั้นน่ะเขาไม่ฟังเราเลยครับแล้วก็แต่ละอย่างที่มาทำเนี่ยต้องบอกว่าคือดร.พรเป็นหนึ่งในคนที่เป็นหนึ่งใน dermatologist ที่ทำ product เองและใช้ product ของตัวเองจริงๆจำนวนนับเคสไม่ถ้วนเพราะเขา traveling around the world every week นะครับทุกเดือนเพราะฉะนั้นคือบางสิ่งบางอย่างอาจจะไม่ได้เห็นด้วย confirmation ด้วย paper แต่มันถูก confirmation ด้วย experience แล้วก็ประสบการณ์จริงที่เขาทำเราดูได้ครับเราไปทำได้แต่ไม่ต้องเหมือน 100%